Today's topic is an important one, and it's one that's often not addressed, particularly when it comes to men and even to children. We've spoken a little bit about this on the show before, but we're going to go deeper today, and it is the health of your pelvic floor. And we often associate this with pregnancy or perhaps menopause, or a woman has her uterus removed, these things such as that. But we don't realize that this pelvic health it's really a lifelong thing. And I'm going to ask our expert in a moment, but I'm sure that most of us at one point or another may have an issue with this and not even know that we have an issue. So we're going to dive into all this and more with my guest today. So today I have with me Melissa Parra. She's been practicing physical therapy for 30 years. Her journey towards focusing on pelvic health included 2 years of medical school at the University of New Mexico. It was then that she decided she really wanted to work with patients hands-on and really have more one-on-one with them. So she decided to shift her focus to becoming a physical therapist. She graduated from the University of Maryland at Baltimore with her master's in physical therapy. And then during her first job at Northern Navajo Medical Center in Shiprock, New Mexico, she took one of the first continuing ed courses offered on pelvic floor physical therapy. And this really allowed her to tie in some of her medical school training with the physical therapy. Now, life circumstances eventually took her to Minnesota, where she was able to get a job continuing her growth in pelvic health education and treatment. And she became a co-lead for the pelvic health program, which included 30 plus therapists. She has been treating both men and women and has treated even children, as we mentioned in the beginning, for pelvic floor disorders for the past 16 years. She also has completed a certification in Integrative Health and Wellness coaching through the University of Arizona. And she is now practicing here where I live in Albuquerque, New Mexico, with Active Solutions Therapy as a pelvic health physical therapist. And also she does health coaching. Welcome to the show, Melissa.
Thank you, Carol. That was lovely.
So we have a little bit of a backstory of how we're meeting one another. You've heard me on this show probably about 1,000 times mention my nurse practitioner, who is Melissa Parra here in Albuquerque, New Mexico. She was the one who really helped me through the transition of menopause, getting on bioidentical hormones and optimizing my health. She continues to be my practitioner. I've been with her for many, many years. And then her sister moved here, began to take up her coaching practice and also continue as a therapist. And I thought, wow, what a great guest to have on the show with all of her knowledge, because I think the pelvic floor to me has always been a bit of a mystery. I first heard about pelvic floor health. I was like, I think in my 30s, taking one of these abdominal core classes. And they were telling us, oh, we have to do these exercises and these planks and whatnot for our pelvic floor. And I'm like, why are we doing that? I didn't get it at all. And then later on, it kind of looped back around where my son actually had a few problems in childhood that turned out to be related to the pelvic floor. And so I'm realizing the connection to our overall health. So Melissa, why is this important? Why should everybody care about this topic?
Well, boy, that's a loaded question for sure, right? Yeah. I mean, there's so much to the pelvic floor, pelvic health, however you want to look at it. I think that, if I can think back to when I first started to become more aware of, the pelvic floor, or just, things that could go better for me personally. I was pregnant and I had pubic symphysis separation from going for a run when I was 7 months pregnant. I didn't really even know there was anything I could do about it, even as a physical therapist at that point. And luckily, I got through my first delivery. Although, again, these are things that happen and that have led me to believe that more education, or even just like every woman who goes through childbirth, either I would love it if it would be before for some birth prep and then after, because there's so much that goes on there. I mean, birth is a huge event. I mean, the pelvis gets, the bones get moved apart, the pelvic floor muscles and tissues get stretched. They've got to let a big head, or in the case of a breech, I mean, even bigger. If it doesn't happen that way, there's C-section. I mean, there's so much that happens with regards to that I don't even think we really thought about it. And we think about people getting a rehab for a total knee or for a total hip replacement. It's just automatic. The surgeon will send them there. And that's not even still, even though I think I took my first course in the 90s, even still with all this education and all that we try to do as pelvic health therapists, to try to get that information to the doctors or providers, we still don't get very many referrals for such. I ended up with prolapse after, more than likely, it was after my first child was born. I don't think I knew it until I went to my own pelvic floor education, and we had to treat each other and do our assessments on each other. And then I realized, oh, wow, I kind of have a pretty, I mean, it's not that significant, but I've learned about it. I've learned a ton with respect to just prolapse itself, which is only one small area of what I do as a pelvic health therapist. There's a lot of other things that I treat. So when you say, why do we need to be concerned about it? I really would, in treating kids, I realize that in the school system, we don't learn about our bowel and bladder. We don't learn what is normal. We don't learn anything really about it. All we know is that the teacher has control over whether we can go to the bathroom or not. And oftentimes it's discouraged because they think kids are just trying to get out of class. And so, we're taught to hold, hold, hold. And we're not really taught, what is normal, and also how to let it out either. And so, you talk about your son, and there's so much there with regards to that. So, health classes, I mean, this kind of like, I think one, I should make this one of my missions, is just to start educating in the school so that kids know that it's not okay to hold for the whole school day. 7 hours. I mean, if you and I had to hold our bladder for 7 hours, that may become very uncomfortable, or, things would start to go wrong in our bodies. And so there's a lot that we don't know as human beings about how things really should be. Sometimes people think it's normal that they should leak when they get to be 70 years old. Well, it doesn't have to be normal. And, in addition, like, well, what about the backside? What about the bowels? People are always concerned about the urine leakage, but oftentimes it's the bowels that can really have an impact for the bladder as well. And that's truly often the case for the majority of children. So those muscles that are down there, they have a lot of jobs. The jobs include, well, I love my model. This is my friend. I feel like model, right? So you see how much muscle, people don't often realize how much muscle is in that pelvic floor and the different jobs that it does. And so what they often call it, like, the 5 S's. So one of the things is that it's supporting all the organs that are up inside. So when there are support problems, that's called prolapse often. And another one of the S's is its support. I mean, it's stability, excuse me. So it's part of what we use in our core, our inner core muscles, and our system. It works as a system to provide stability for the pelvis so that we can carry the load of our body and be able to move our limbs and our bones and not just completely fall apart. But again, issues happen there. Like for me, when I had that symphysis separation, I had some issues with that stability problem. And then the muscles that go around the openings, the little slips of muscle, those are sphincters. And so they have like a circular kind of configuration, and they squeeze around and they help us maintain the continence. So that's another one of the functions of the pelvic floor. And then also the sexual function of the pelvic floor. These are the muscles that are involved in arousal, and they're involved in, orgasm. And oftentimes there will be people who have dysfunction with respect to some of that. People who have persistent arousal disorder. You can have something going on with the nerves that are just really revving up that system. Or people who are having trouble, especially men with the erectile dysfunction, or that can happen in women, where all of a sudden you kind of hit maybe a little closer towards menopause or even before. And It's like, where'd my orgasm go? Or it's not as satisfying, it's not as good. So there's a lot that goes on with regard to just that. And then it also acts as sort of a sump pump to help with like the flow of the fluid, throughout the area of the pelvis. So it's got a lot of jobs. And so any one of those S's can be an issue for us or multiple for us as individuals. And so when people don't know what normal is, or they don't know what symptoms they might be having that could be related to the pelvic floor, the doctors will sometimes, or providers will sometimes know and say, oh, yeah, maybe go see a pelvic floor therapist. But oftentimes there's still a lot of confusion around it in terms of what we do and how we can really help with a lot of these issues. I hope that wasn't too much.
No, not at all. It was really interesting because it's so much more than what we think about. Even when you were talking about the sexual function, I had never heard that it could cause the opposite, the arousal, where it's, just constant, almost like that.
Yes.
I guess, for lack of better words, like the faucet's turned on and you can't turn it off. I had
Yes.
never heard that. So that's fascinating that it can go both directions.
Yes. And some of the people that suffer from that, it's a very, very distressing symptom to have. So, I'm glad we're here and there's a lot that we can do to treat because, pelvic health therapy, I think when I first started doing it, people would say, well, why, oh, you treat those things, or why do you want to treat those things, but, we have issues that go on in our body related to problems with our muscles and our nerves and our tissues and our joints. And, it's another area of the body where all of that is there. And I think it gets a little bit intimidating for people to sometimes think about because it's a very private area. And so people often don't really want to address it either because they feel nervous about it or because they just kind of feel like, oh, well, I can deal with it, or it should be normal if I'm older or I'm menopausal or I've had a baby. Yeah, there's a lot of, I don't know, just still some nervousness about it, which I hope in the podcast to kind of dispel because you know, what we do as therapists, most of us are extremely kind. I would say probably everybody I've met is extremely kind and just wants to help. Really, I try to meet people where they're at. I've had a couple of people who've told me, no, I don't really want you to kind of go there. And I said, well, there's still a lot more that we do. There's a lot of things that we can still do and teach people about with regards to how the whole pelvic floor works with the bowel, with the bladder, with the colon and the rectum with regards to even pain. There's just a lot to it. And some of that, honestly, and I think I remember your guest who was I think she was a urogynecologist.
Yes.
Yes. So there's, again, the pelvic floor, and this is related maybe even to those kids that, and your son, I've been told, and I don't know if this is 100% accurate, but I've been told that it's the only skeletal muscle in our body that receives nervous supply from the nerves that comes from the autonomic nervous system. And so that autonomic nervous system is the fight or flight or the rest and digest. That's kind of like they have like two parts and they call it the fight or flight and the rest and digest. But really what that system is, it's a system, is that part of the nervous system is very attentive to keeping us alive. And so it has a very protective kind of mechanism because our bodies are wired for survival. And so because of that, when we'll just talk about children, sometimes when children, there's been a big change for them, something scary, right? Like I'm starting kindergarten, or my parents got a divorce. There's a big change in the house or something. Often that's when these problems start because the muscles just kind of like protect us and they can just kind of get tight and they hold, and then the kids start getting into this pattern of basically holding and not letting things out. And then that can kind of create a cascade of bowel and bladder problems for them. But I see this in adults as well. And sometimes it's a remnant from when they were a kid. Like, we go through this whole history when we see people, and we'll often find that there's this, oh yeah, I had used to have a lot of bladder infections as a child. Or, yeah, I remember my mom or my dad taking me to a doctor. I wet the bed till I was 11. I mean, a lot of those things can start early, even as infants, to be honest. And so, and there's a lot more to it. There are other outlier reasons for some of these things, but they still happen in us as adults. And so, again, I have experienced a lot of these things because I have a pelvic floor, right? And we all have a pelvic floor, and they're not uncommon things to happen. People often think of it as just urine leakage. No, there's so much more that we see. There's people who don't have leakage, but they have urinary frequency, like they need to go to the bathroom all the time, or they feel like they can't control it and they're crossing their legs, and barely making it to the bathroom, or um, they only have problems at night where they have to get up a lot at night, or, they'll just feel like they get a lot of bladder infections. And that can, sometimes it's not related, but sometimes that can be an issue too. And then there's the whole other, not even bladder, there's the bowel of constipation, or do they empty their bowels fully? Do they have to strain or push to start a urine stream or a bowel, to start the bowel movement? Are they getting it all out? I mean, there's so many little things that people think aren't necessarily a big deal, or maybe it is a big deal, but they don't know where they can get help. So, hopefully people will take it to their providers and say, hey, I listened to this podcast and I found out that if I have this thing going on, I can maybe go see somebody about it who can help me with it. Because there are other things, in the medical system. There's surgeries, there's medications, but pelvic floor physical therapy doesn't really have a massive negative side effect. Some of these other things really can be more detrimental, or be bothersome for us when we start taking them or have the surgeries or whatever it is. Yeah. I'm a
Yeah, so the physical therapy allows a avenue for really everyone to explore that is not so drastic as surgery. Not that surgery isn't sometimes necessary. I'm sure in certain situations, depending on what's going on, but it's like anything. I had back surgery almost a year ago, a spinal fusion. But we started with physical therapy. We did everything we could with physical therapy. So I'm a believer, start there with the therapy. And then if you're not getting results, explore other avenues. But something you hit on that really, really struck me is that connection to the sympathetic nervous system. I had never, ever considered that, but it makes perfect sense because I talk to my women a lot about the fight or flight and the release of cortisol and what happens in the body, and everything stops. So insulin can't come in and really shuttle the blood sugar. The blood sugar is going up to prepare us for action. Blood pressure is going up. Digestion slows down. Any chance of fertility or all of that goes down so that your body can respond to this emergency at hand. So it makes sense that those issues would be linked, because what would we be doing in that situation if blood pressure is high, heart rate's high, every other bodily function is stopping? You're clenching. I know I've caught myself clenching, and it's like my whole body. It's not like, just
Sure.
clenching my jaw. It's like my whole body. So fascinating, that link. And you could see where those habits would start in childhood.
Yes, yes, for sure. And that's the interesting thing. You were talking about all these changes and all these things in the body. And I think that I've really had to just open up myself to really like learning about a lot of different things, and kind of paying attention to a lot of different things, because it's not like we just take a muscle out of the body and go, "Oh, here's how it works." I mean, I think sometimes we tend to be isolationist as providers, especially in Western medicine. And I've had to learn so much more about all the links and the connections. You talk about hormones. Well, hormones, that's another part of it. And then you talk about the neurology. Well, you have a brain. And the brain has places where emotions are processed. And there's a lot of talking, there's a lot of communication there. And I've had people who well, I have had a lot of people come in and say, "Oh, my bladder urgency, or I need to go pee more often when I'm feeling really stressed or when my anxiety is high."
That's me.
Yeah,
It is
yes,
me.
exactly, yes, and so it is important for people to learn not just about the muscle and what the muscle does, but how it works in the whole body, how it works as part of our system. And again, that could be, oh, well, this is how your nerves work. And this is what, goes in and out of your bladder or your bowel. But, in terms of like what you were talking about with like the plank and how they were saying, oh, that's going to help your pelvic floor. And, it's like, yeah, your muscle doesn't just stop. It doesn't just stop at the bottom of the pelvis. That we're all it works as a system, and part of that system is thinking about our nerves, is thinking about our hormones, is thinking about just generalized, sort of a more holistic kind of way of helping ourselves too. So I do talk to people a lot about their diet because that can be a contributing factor for a lot of these things, or their habits, patterns, even how we sit on the toilet. I've had some people like who tell me I will not sit on the toilet. I have to hover because I don't want to get the germ. I mean, there's just a lot of little
Yeah. Yeah.
come up, and everybody, that's the one thing, is everybody has a different story. Everybody has you are all individuals. And so, yeah, if somebody absolutely cannot, for whatever reason, insurance wise, or because it's going to take 7 months for them to go see a doctor or a provider, to get them into therapy, I am glad that there are some things, that some of my colleagues in physical therapy and occupational therapy have put out, just online or apps or those kinds of things. That is great. But again, sometimes we all, because of our own story, may not realize that something is connected and related, and we may not think it is, right? Because we didn't learn all these things about what was
Right.
normal when we were in grade school. Yeah.
Yeah, it is interesting. Our modern society works against us in some ways because, okay, to sit in a classroom all day long as a child, I was a second grade. Well, I taught various grades, but I taught first, I taught second, I taught kindergarten. So I'm very aware of the bathroom thing and trying to discern as a teacher, are they just trying to get out of class and go down the hall and play in the bathroom with the water faucet? Or do they really need to go to the bathroom? It was tough. And I remember at one point, even like drawing a picture of a bladder on the chalkboard, trying to get them to understand,
Okay.
okay, this is what happens. It's filling up, and you don't wait to the very last minute,
Right.
let me
Right.
know. And I remember doing all of these things to try to help them because yeah, they are little kids and they're not always in tune to those signals. They wait to the very
Right.
last minute, like gotta go. Now,
Right.
what are the signs starting with childhood for a parent or a grandparent, because we have a lot of grandparents that listen that are caring for
Sure.
their
Absolutely.
grandchildren. What are the signs for the boys and the girls?
Yeah. Well, if you can remind me to go back to something that you said, we'll talk about interoception in a bit. In terms of things to watch out for and look for, I would say that one of the big ones is sort of like that wiggle or the dance. That some people, or the holding of the crotch, crossing of the legs. That's that sign of like that urgency.
Hmm.
I mean, maybe every once in a while if you see it, but if it's like definitely more frequent, that could be a sign. And, sometimes if there's sort of more fear, I would say, involved, sometimes the kids will fight you and say, no, I don't need to go. Or, they want, kind of privacy, or they're sitting there and they're really like having to push, like, they'll make this sort of grimace and, have to push. We shouldn't have to push to start our urine stream. That is one thing that I don't think people realize. Sometimes we'll have to give a little nudge for that bowel movement piece, but, you know, those can be some of the signs. Obviously, wetting the pants, right? Or overnight bedwetting. Again, I'm kids was something I did for a while. It's been a while, and I heard varying stories about when it was normal to wet the bed and when it wasn't. But, I think that in general, like early elementary school, kids can still kind of do that. One of the providers I worked with said 8 years old. And of course, underwear, stains in the underwear or wet clothes, those kinds of things. Because sometimes even those things we call like skid marks can be a sign, especially if you see them. So I always encourage parents to say, maybe if you're not sure, just kind of like if they'll let you, and hopefully that'll be a good relationship, having the parent wipe them and then maybe checking like late or get a fresh pair of undies, clean it off. And then if you see it later again that day or that night, that could be a sign because that's not just poor wiping. It could be sometimes the stool just kind of seeping around. And so those are, some of the things to kind of watch out for. And there are a lot of teachers, or maybe some of the people that will be watching are teachers, so those are also things to watch out for too. Or obviously frequently asking to go to the bathroom, but I remember talking to a teacher, no, a parent that was saying the teacher was giving coins to the children. And so they would get like an allotment of coins. And when they needed to go to the bathroom, they'd have to turn one in. And at the end of the week, they would be able to turn in these coins and they would get like for the coins that they gave, they would get extra chances to draw out of a bucket for a prize. So it was basically incentivizing not going to the bathroom, the teacher. So I was like, so I had to call the nurse and I'm like, please don't do that. Like, that's just not a good thing to do, because it's a hard enough problem as it is. And I think in general, there are a lot more children that go through this than we really realize. Even my own children, I remember them like for varying reasons, because sometimes it's not even like a fear thing. Like, I think my kids didn't want to go to the bathroom at school because they didn't want it to be stinky, right? They didn't
Mm.
poop in front of others because it was stinky. And so I would notice my boys, particularly getting off the bus, and then they would bust in the house. And the first thing they would do is race into the bathroom and go, and this was before I was a pelvic therapist. So then I didn't talk to them about, I didn't know to talk to them and say, are you going at school? Like, so if you see those kinds of behaviors, like, are you going at school, and figuring out how to help them get comfortable with the idea of going at school, or figure out what the barriers are, because maybe the barriers are something like this teacher incentivizing not going to the bathroom, right?
Really good points. I was laughing so hard because having 3 kids, I had two that did that. I mean, they would just bypass me like we're walking home from the bus stop, which is just down the street, and they're running and they're
Yes.
running right in to have a bowel movement. And I'm like, really? All day long, you've had access to a bathroom, and right now it's an urgent. And
Yes.
my middle child had the hardest time because she almost developed this phobia about public restrooms. It was very
Yes.
odd. Yeah, she had a
Yes.
phobia about it.
Yes. And I those are hard things to deal with. They really are. So, again, I'm a physical therapist, not a mental health. And so
Right.
I feel like, especially when the child starts to have more significant problems, the team approach is the best. I think whoever is the provider, either for GI or the urology, the physical or occupational therapists, and if needed, some sort of, psychology or something like that. I had and the pool is small. It's unfortunate, but the pool is very small of, people that I had to be able to refer parents to. And the parent, of course, has to be on board, which that's also a struggle too. But
Mm.
yes, I mean, that fear can be real. And I don't, it may take something special to kind of work through some of those fears. Sometimes it's a little quick fix, like, the automatic flushing toilets. You can kind of hang a little piece of clothing over the eye, right? And so that doesn't make that loud noise and that scary, you know.
Yeah. Yes.
Right,
Yes. That's a
right.
big one. Many
Yeah.
parents will relate to that, and grandparents.
Yes.
But I mean, you do bring up an important point about that integrative approach and having a team, because for many of us that are in physical therapy, anywhere in the health space, there's such an overlap between the physical and the mental. It does overlap in adults too. And I think, and then we don't want to be outside of our scope of practice, of course. So that team approach, I hope to see in this country more of that, and people not being in a vacuum. Like, okay, I'm over at the psychologist. Now I'm over at the rheumatologist. Now I'm over here for my hormones. Now I'm
Right.
going to the physical therapist. I mean, I know sometimes I feel like I'm running all over town.
Yes, yes, exactly. I know, I know. And the providers that can sometimes be a little more integrative, and sometimes they're called integrative, nurse practitioner or PAs or doctors or functional medicine. there just aren't a lot of them either. So that makes it tricky.
It does, and finding a good one. Now moving on to adults. Now,
Mhm.
we know that women go through pregnancy, they can often have problems. What about younger women that haven't yet had babies? Can they have problems too?
Oh, absolutely. Again, anybody with the pelvic floor, you can have it, So I've treated, even teenagers who will be in track and they'll leak. Usually not often a pain problem, although there are people that do experience pain, and there are varying kinds of pain. This is one of the things, again, thank you for bringing this up. The young women that haven't had babies, but they may go to their first gynecological exam and it's extremely uncomfortable or
Yeah.
painful, right? Or even from putting a first tampon in, that is definitely something that would warrant, physical therapy. If it's the first time, maybe not, but again, just like with repeated attempts, some of it can be that the pelvic floor muscles are, tight, and there can be varying issues with regarding, just again, some of that autonomic nervous system sort of protective response. But then, sometimes there are reasons for the muscles to be tight, like there could be biomechanical reasons for it, but also, and I'll just kind of show you here. So at the opening here in the vaginal tissues, we have a little in the inner labia, there's like tissue there that embryologically is the same as the lining of our bladder. And I'm not going to go into the mouth, but the mouth can be related too. But there can be some diagnoses that some of these individuals can end up with, which is called like vulvodynia or vestibulodynia. And it can be like a very severe pain. And it's just, I don't know where we are with the research today, but they they've they've struggled kind of coming up with like causes for it. And it's very uncomfortable, and it can feel like a burning or a cutting almost. And so um, I definitely see people who have that, whether they've had children or not. Oftentimes it's a barrier to having children, right? Because they feel like they can't even tolerate having vaginal penetration. And so those are definitely things that we see as physical therapists. And then of course there's just generalized sort of pelvic pain. So sometimes people with endometriosis, or what is the one I'm thinking of, congestive pelvic congestion syndrome. Sometimes, there can be things that we can do and help with that as well. Anything that basically lies in the pelvis, which means, uh, the abdomen, the lower abdomen here as well. There's some pelvic therapists, and I will never say that I'm fully trained because I'm not at this point, but I do some mobilizations in the abdominal wall, scar tissue mobilization. So a lot of C-section scars, but also people who have endometriosis and other conditions like that. There can be some things that can be very helpful with that for them. And, some of these, just like endometriosis, there's a lot of connections with endometriosis and some of these pelvic pain conditions. Again, we're talking about our nervous system and trying to work through things in our nervous system, because central sensitization is when our nervous system kind of gets like really ramped up, and it can kind of keep the pain going, versus when we cut our elbow or something like that and it heals and then the pain goes away. So it's the persistent pain. And endometriosis is one of those things that can be included in some of these central pain conditions where it's this persistent pain that keeps going. So there's a lot, and again, in the world of physical therapy that can help with some of those things as well.
What are the modalities you mentioned a little bit when you were describing this that you
Yeah.
use in treatment?
Yeah, so I do some things to kind of help dampen down or kind of regulate the nervous system. Breathing is big, but not just breathing, but also just kind of like body scan, just attention to the body, helping people work through some of that muscle tension and tissue tension. And then some of that is actually manual therapy. And so I do use my hands a lot in therapy and work through some of the issues with either the biomechanical, the muscles. I'm bringing in lots of blood flow, teaching people how to do that for themselves. And there are other individuals, I'm not trained in it, but that do dry needling. So it's like the use of acupuncture needles to
Yes.
help with kind of the muscle tension and tightness. I do not use a lot of I will use electrical stimulation, so some of the things that maybe people remember, "Oh, yeah, I remember having that machine on my back." I primarily will use some of those for either pain or some bladder conditions, and it's usually not necessarily in the office. It's teaching people how to get their own little tens and kind of do some of that on their own if need be. And again, ultrasound or heat, like those things, if I have time and it's like a person's really suffering, of course, I can go and help with some of that. And then, of course, exercise. Movement is great for anybody, unless, of course, there's the part that they are not supposed to be moving. But movement is very helpful for people who are in pain, looking at the movement system. So, again, thinking about how the muscles work together with the pelvic floor. So, sometimes it's not even like a person may have really wonderful pelvic floor strength, but still leak. Right. So working through and looking at their bodies, what are they doing in their bodies, their habits, their pressure system, that kind of thing. And then some of it's just educational, honestly, like, okay, how are you sitting on the toilet? What is your technique to get things out? What are you eating? What are you drinking? How often are you going? We sometimes will do a bladder diary, or just like looking at that and helping people to tap in. So here's the other thing that I told you to remind me of the word interoception. So interoception just means how do we know what or in our bodies when we know, let's say, that we're hungry. How do we know that we're hungry? Right? What signals are happening in our body to help us know this? And there are kids who have like ADHD and some of these other diagnoses who really struggle with that piece, who really struggle to attune in and tend to what's going on. And there are adults who struggle with it too. And so, just kind of like working through some of that if need be as well. Like, maybe they're bypassing the first signal of their bladder, right? And not really knowing that it's getting full. And I think sometimes we do shoot ourselves in the foot when we have certain professions, teachers, physical therapists, occupational nurses and doctors sometimes. I mean, I felt so bad. I had a lady, she did well, but she would be in surgery sometimes for 7 hours.
Wow.
And yeah, there's these jobs that sometimes kind of promote that, we're gonna hold it, we're gonna hold it, we're gonna push past that. And then sometimes I think the nervous system signals just we stop attuning to them, and it makes it a little harder to kind of like, okay, let's pay attention, sort of like a piece of mindfulness, I guess, to really kind of tune into what you're feeling in your body. And so I will work with some of that if need be. And yeah, I don't think I left anything out. I don't know. Hopefully I didn't.
I think it's interesting how the brain can train us one way or the other. So I could
Yes.
see this happening because I worked with a lot of nurses, emergency nurses, and especially during the pandemic, it was a big thing. They'd tell me, well, I can't drink the water you'd like me to drink because I can't stop and use the restroom. And so they were in the habit of just turning off the signals and even functioning in a dehydrated state because of
Yes.
how many hours they had to go without being able to access the restroom.
Yes, I know. Yeah. I only had a couple from the, surgical suite that would see me. So I don't know. That's another area where I wonder how they do it. Do they take a break midway through surgery? I would imagine, I would hope so. Somehow they have a system because that doesn't quite seem fair.
And then the other thing I thought of is like the type A executive people or just type A people in general. I consider myself, well, a recovering type A person. I've learned to back off the perfectionism, but I'm wondering, does that play into it too, where you're just constantly keyed up, trying to keep up with certain things, your job, career, family?
Yes, I think I do tend to see people struggle with that, who will struggle with like their bowel or their, bladder in various ways. Some of it's just muscle tension because again, I have a lot of people that come in and they say, I just don't know how to let go. I don't know how to relax. I don't like using the word relax, but just kind of trying to figure out how to deal with the muscle tension in their body. And they've said, it's been with me my whole career or whatever. Or just people who just are so busy, busy, busy all the time. And then of course we have technology, right? That's another thing to take our mind away from what we're really feeling in our bodies is, we're looking at the phone or we're tending to phone calls or emails or texts or so yeah, we do sometimes need to pull ourselves back and just become a little more mindful, I think. Yeah.
Now, you mentioned earlier, you talked about people having a strong pelvic floor and still having problems. And I think I definitely have fallen into that because I have a background of 10 years of doing bodybuilding shows. I was in the gym training really hard. And so I felt I had a very strong pelvic floor, but something you do when you lift, especially when you lift heavy, is you clench. And
Hmm.
you don't just clench with part of your body. It's why the abs will get almost a workout doing, say, a squat or a bicep curl because you are in attention mode. So
Hmm.
can we take that too far? Because I think of the old Kegels and they would say, do your Kegels, do your Kegels. And
Yeah.
I think I was doing Kegels all the time when I was weightlifting that much.
Yeah, and that was one of the things I wanted to drive home too. It's not all about the Kegels, and sometimes people can do themselves, I don't want to say damage, but there's just some areas where you really probably don't want to be doing Kegels. And in the instance of somebody who has a very tight musculature who is having trouble. Oftentimes it's pain, but sometimes it's, again, leaking even so, because if the muscle is already kind of clenched and tight, it doesn't have much more to go. It doesn't have much more power to give to help to be able to provide that closure. And so in those instances, I work with people on the opposite about how, we're going to try to get blood flow into these muscles, these tissues, and we're going to try to allow the muscles to have some, you know, not always be held so much up here, but just to kind of let go a little bit. And, again, some of that I work through with people who don't feel like they empty their bladder fully or their bowel fully. That's often an indication, or sometimes who have to go to the bathroom frequently because they're only letting out a little bit at a time, or they'll tell me, I just went to the bathroom and like 10 minutes later I have to go again. Those kinds of things can often be a muscle tension problem. So when it comes to the assessment piece, it is helpful to get that internal assessment, even though I know people don't always love the idea of it. But to go for, as a therapist, we don't usually use a speculum, although now some are using some for other reasons. But I'll just lubricate a finger and I'll palpate, I'll feel the muscles. I'll say, okay, what's going on? Especially in someone who's had childbirth, sometimes some of the muscle can get pulled away from the bone, or I'll, sense that there's a prolapse, a bladder support problem, or a bowel support problem, or a uterus coming down. I can't diagnose that, but I can at least kind of sense what's going on. And then again, okay, what is their muscle doing? And is it doing what we want it to do at the given time? So sometimes it's a timing and coordination issue, but you don't really know those things unless you really assess them. And so that's why I like people to come in to just kind of like, let's see what's going on. Let's see what's happening with your body, because we're all individual. And, sometimes it might just be an outright like, yes, your muscles are very weak. Or there's this, very stretched out, there's a lot to it. I think that there was sort of a running theme that, what you do when you go to pelvic floor therapy is you just do Kegels or the
Yes.
pelvic floor
Yeah.
contractions all the time.
Yes.
Yeah, I mean, if you're a male who's had a prostatectomy, right, and you're having some leakage issues, that will often be an indication of what you do in therapy. But again, there's still more to that. Or if, you've just had a baby and things are very weak or something, there might be an indication to do that. But often we're working more, again, with the system itself to see how we can maximize improvement and work through some of the symptoms that people are having. I was just thinking of a situation where I've had a person who just would only leak like at night, and the pelvic floor seemed fine. And once we started working on the constipation piece, all of a sudden that leaking was gone, and really kind of getting that improved. So, it'd be lovely to have like a scope where I could go up and see everything and figure out what's going on. But I use my hands as best I can, or, what I see in the body. And I think that's what, you know, the OTs and PTs that treat pelvic floor typically will do is, do an overall assessment of the things that are connected to it. which for some that, I mean, I will say started more from the pelvic floor and I've had to learn to go to other body parts. But, there's some amazing therapists who will find connections between, the neck and,
Wow.
yeah, yeah, it's pretty cool. And people who are now talking about the voice in the pelvic floor because this part of your body develops embryologically at the same time as the other side, as the other opening. And so, yeah, to just help relax and, don't have a tight jaw, don't clench here, but we'll often find those associations too. People with a lot of jaw tension or tightness or teeth grinding will often have the pelvic floor dysfunction on the other end where there's a lot of tension and tightness down there too. So we're still
Mhm.
learning, we're still growing as a profession and figure all this out. So
Yeah, it is an expanding field. And I think people are starting to become more aware. I'm seeing more podcasts, more books come forward on the topic. Now, what if a woman's had a hysterectomy? How does that affect things?
yeah, so again, I think it's helpful to, if you can, to get like a couple of sessions with a PT before, just because, post surgically, again, it's not treated like the knee, it's not treated like the hip. They don't give you a lot of guidance other than to say, don't lift 15 pounds or whatever the rule of thumb is.
Right.
Well, when you get out of a chair, there's been studies that have shown that if you put a sensor up in the bladder, that's more than 15 pounds of pressure down on the bladder.
Wow. Wow.
So, yeah, so these are things that I don't think that doctors are aware of. And so
Mm-mm.
it's like, okay, so well, how do we manage that pressure? So that's one of the things we work on, like maybe before surgery, just a couple sessions, or even if it's just one to kind of say, okay, this is what's going to happen and this is what I want you to try to do. Then come back to see me. And then, of course, we can always work on the scar. We can see, if they're having any symptoms afterwards. And again, I feel like at least what I've done is that I will try to do that pelvic contraction, that Kegel, for support because they don't have uterus anymore. And so there's a space there. And unless the surgeon's gone and tacked up the uterus, which sometimes they will, I'm sorry, not the uterus, the tissues that were like holding the uterus up. They'll sometimes tack them back and that will help. But there are some times when a person will have a hysterectomy where they're a little more prone to then having the bladder kind of fall after that. And so I feel like teaching people about pressure management, this is how you work with things health in a healthy way. Don't strain, don't bear down. If they're having any trouble around that, then how can I help that be better so that they can learn to not be putting a lot of downward force on the organs that are remaining. So, yeah, there's a lot of benefit coming.
Such useful information. And it really is a shame that a lot of doctors, not by their fault, so I definitely don't place blame here. I just think it's just probably something not addressed in medical school. They're overworked. They've got all this paperwork for the insurance companies. I know I'll see a doctor and your sister's great because she'll spend, a full hour with you. But if you go to a regular doctor, you're lucky if you have 10, 15 minutes, and these things just don't get talked about, they don't get addressed. Now with men, I'm imagining they are probably, I don't wanna say difficult, but it's probably difficult to get this through to them. They don't wanna talk about it. Is that true? Is there a little bit of embarrassment there?
Well, in general, by the time they get to see me, most of them are like, just help me, because they're at that point. I think if the doctors encouraged it earlier, maybe that would have more of the norm where it's like, what is this? I'm not really sure about this. And then we talk about it. By the time we talk about it and we work through like, okay, show them the model, teach them about their body, teach them why things are happening. Most of them are like very comfortable and fine to work through a lot of things. But particularly, I would say, like, men who've had prostatectomies, like, they're very eager. They don't like to leak, and nobody likes to leak really, but, I hear this often from them, and they're more even concerned about that than they are, like, the erectile dysfunction piece, many of the men that I see, and so they're very willing to work through some of the issues that they have. The younger ones who it is not a, surgical kind of thing, and I have had some, again, with the symptoms that we talked about, urinary frequency, urgency, or just what is known as what is the word I'm thinking of? Prostatitis. So prostatitis is often a diagnosis that's been given to these men who, again, have some of these bladder issues or pain. And there was a lot of confusion. I think they're getting better at kind of recognizing what's more pelvic floor dysfunction than the actual prostate having an infection. And so, I will see men with that too. And again, a lot of it is just kind of working through. Let's just try to regulate your nervous system. Let's try to help, get the muscle tension down. And once they kind of come on board, they do okay. But, some of the younger men, I think maybe it's a little harder just because many times it's a female. There are some men who are starting to treat pelvic floor now, and some men don't want a male, they want a female, so it can just vary. But there are some men now who are doing that, and they're actually putting themselves out there, like on social media and stuff. At least there's one or two that I've seen. So it's nice to have options, I think.
It
But again,
is.
yeah, but to have them in your community is a little harder, to have, males who are doing what I do.
That's very true. If you go on social media, yes, you can find experts, but to find them locally, I have noticed. I go over to Langford PT here in Albuquerque, which is very good. And I did notice when I had my back surgery, they weren't addressing it to the point that you do, but it was definitely part of recovery from the back surgery. So I did notice that at least in some respect it was being included.
Yes, they are getting better, I think, in physical therapy school, but also just like in continuing ed, like, you need to ask about this because, again, it's that system, right? The nerves in the lumbar spine, innervate the bladder. And so, and, in the sacral area, they innervate the pelvic floor. So it's part of a system. And so, rather than, oh, I don't want to talk about it or I don't want to look at it, they should be asking about like bowel, bladder, sexual issues. And then of course there seems to be, many, not everywhere. I realize in very rural areas it's probably a little harder to find a pelvic floor PT, but we're becoming much bigger in terms of the number of therapists that are around. So it's nice that, if people want the help, that we're here, and they should be able to find somebody, hopefully without too much hardship.
And it's good to have these open conversations. I think that's where it starts, where people maybe aren't aware. They listen to a podcast, they hear people talk. It's an open conversation, and it gets you thinking, well, perhaps I need to explore this a little bit. Now, I want to be respectful of your time, Michelle. As we start to wrap up, was there something that we didn't hit upon that you think would be important for the listeners and those watching to know?
Yeah. Oh boy, I feel like I went around and around and around. It's interesting doing a podcast because it's not like a formalized lecture where you hit all your points and you made sure that you
Right,
were clear
right.
and you did it well. So hopefully I didn't confuse anybody. I hope not, but I just wanted to just make sure everybody knows that, even though the initial thought of it may seem intimidating or scary, again, the it's very common to have something in the way of a pelvic floor kind of diagnosis or dysfunction, right? Even if it's just from the bowel. And, some of it fine. People are like, oh, I'm happy just taking my Miralax, or I'm happy just doing whatever. Some of those things are fairly benign, but then there are other things that can be a little more significant for people. For example, some of the bladder medications they give you dry mouth and then they constipate you, which again doesn't help, right? And so it just kind of compounds the issue. Some of them, I guess they're now talking about as maybe contributing or potentially contributing to like some dementia or Alzheimer's. And, so there's just things to kind of make sure that you have open conversations with your providers about in the flow, at least regarding bladder issues, in the flow from urology. Pelvic floor therapy is one of the first line treatments, and it's been proven to be fairly effective. You may not get 100% dry, but, to know that you are managing it pretty well and you're doing pretty well. And if you decide, no, I don't want to go to the extra step of having a medication or something more invasive, it's just good to give it a try. And, don't try like 1 or 2 times and say it didn't work because,
Mhm.
the first visit, at least for me, it's like a lot of intake, a lot of assessment. We don't really get to talk about a lot of treatment in that first session. And then like some of the insurance companies, they'll actually say like, we're not supposed to bill for certain treatments like on our evaluation day. So I mean, it gets a little tricky and sticky, but just know, just give it time. I usually tell people 3 to 4 months is like, plan on maybe seeing me. We could get done sooner. We could go a little longer depending, but I mean, that's about the ballpark, especially if it involves strengthening of the pelvic floor. There are things like vaginal weights and stuff, like little vaginal barbells.
Really?
Oh,
No
yeah,
way.
there are. But, if we're looking at trying to get a muscle to really strengthen, if that's the issue, that takes 6 to 8 weeks right there. And I tell people, you can see changes even 6 months to a year, depending on what it is that we're working on, if it's just like if we're talking about just the incontinence piece. But yeah, and don't feel concerned about talking to the doctor and just saying, hey, do you think that I could try to go and get some therapy and see if that could help me? I think the doctors are often, like you said, they get really busy, or the nurse
They do.
practitioners, or PAs, they get really busy, and they're probably trying to treat you mostly for what you're there for, unless that's your primary issue. They may mark it down, but not necessarily remember to say, oh yeah, why don't you do this, or talk to you about how much it's bothering you. And again, so I think people are getting better at talking to their doctors about some of these issues, but again, um, we I'm not going to fault anybody for forgetting, or, not talking to you about your bowel or your bladder or your sexual health. People just sometimes it gets to be busy, especially in New Mexico, where, there aren't a lot of providers
Yes.
around. Our nurses and nurse practitioners and PAs are pressed for time, and,
They really are. They really are. I can empathize with that. I think sometimes people get so impatient and upset with a practitioner running behind or not spending time, but I'll see them just frantically going from office to office, seeing patient after patient with just no break. And it's difficult. So I think it's good to have this avenue where you go to somebody specifically for this who can spend that time with you and work on the issue. Now, how can people reach you, learn more about your work, and then with your health coaching, you're able to do so online? Is that
Yeah, so I'll just start with the PT part. So right now I'm in the East Mountains of Albuquerque, so I do Cedar Crest and Edgewood each a day a week, and then I'm out of my sister's office 1 day a week in Albuquerque. So that's called Active Solutions Therapy. So it's a physical therapy clinic that I'm the only pelvic health provider, although I think we're going to be getting another person who wants to learn, which is great.
okay?
And then so there's just one general number, which I don't know if you want that now, Carol, or I can just send you the information to do show notes or however you do it. But, if anybody's local, definitely. I know the wait time for pelvic floor therapy is probably anywhere from 2 to 6 months for other pelvic health therapists. But since I'm new and people are having a hard time finding me, I can see people like that week or even the next week.
Wow.
Yeah, at least right now. I hope always to be able to do that, but sometimes, people find you and you get really busy. So that is one way, is just the and that they do have their website, activesolutionsTherapy.com.
Okay.
And there's only one number that you call, and it's for all the different sites, and then they can guide you, because we do take most insurances. The sad part is, like, I think it's Cigna, and then like Humana, Medicare are the two that we don't. Otherwise, we take
Okay.
most insurances, which I really wanted to do that. That's one of the reasons I don't really do practice on my own, is because, I want to be able to see people, and not have them have to pay out of pocket all the time for that. So the health coaching insurance that I know of, they're starting to work on billing codes and stuff, but that is something that typically people don't get paid for from insurance. And it was an integrative health coaching certification. So again, that's where I work with people on just like changes, health changes, whatever that looks like. So sometimes people get surprised and they'll find that maybe they thought they wanted to work on their diet, but these other barriers came up and they really need to work on
Yeah.
this other part of their health, right? Yeah, so that is, I don't have a website yet. I probably should do that, but that is my name, so Michelle, so Michelle J, and then my last name Parra at gmail.com. And anybody who emails me that way, I can certainly set up. So I have the capacity, if you're in Albuquerque, to see one-on-one, face to face. Sometimes people just want to do phone calls, and sometimes it's a Zoom session, kind of like what we're doing. So I can do all three.
Okay. That's
Yeah.
wonderful. I'll make sure all of that is in the show notes
Okay.
so
Thank
that people know how to reach you and work
you.
with you. I mean, I could have kept, you're just a wealth of knowledge. I had so many questions. That's probably why we were all over the map. It's me.
No, I don't know.
It's the way my mind works. It's like, oh, what about this? So thank you so much for taking time today, Michelle.
Thank
I
you
truly
for having me.
appreciate you. And to
Yeah.
our listeners, wherever you are in the world, we wish you every blessing. Bye for now.